Hi, I'm Ashlyn, and I'm a nursing major here at Clemson University. So I chose to focus on the differences in healthcare between our culture and the Hispanic culture. Maybe the largest difference between healthcare in the United States and healthcare in a Hispanic country is the availability of healthcare to every citizen. In Panama, healthcare is free for every citizen, but a problem lies in the fact that the free healthcare is usually not nearly as adequate as healthcare that can be paid for. Private healthcare, which provides much better care, rivals that of Western countries, but at a much lower price. Now Daniel, a Panamanian citizen, will give more information on the healthcare system of his country.
Hi, my name is Daniel Castro and I'm from Panama City, Panama. I'm a citizen of the country and I was born and raised there until I was 18 years old. Today I'm going to tell you a little bit about the healthcare of our country. And particularly, let me tell you about my family background. My family comes from a middle class background and we can afford private healthcare. And pretty much everyone that I know that's from the middle class also uses private healthcare because although the public healthcare is free, it is often known to be very slow, it takes hours, and it is rarely ever, I wouldn't say rarely ever reliable, but it isn't that reliable. First, let me cite an example that happened back in 2006 with what they call the diethylene glycol incident. And what happened essentially was that the Social Security, which delivers the medicine, was giving out a medicine that was for industry purpose and not for human consumption. And it was an accident that happened. One of the companies that supplies the medicine to our country accidentally supplied something that was for industry use, and it was a huge phenomenon because over 130 people, or I believe it was 130 people, died in the incident back in 2006. And this is terrible because how are you going to rely on, it was a simple cough medicine, right? And how are you going to rely on the government to give you good medicine if the government's giving medicine that kills people? It was kind of really shocking and it hit home. And so that's essentially why most people use private healthcare. Now, another incident was my grandfather, who recently passed away last year. The doctors from the Social Security had recommended that he take this medicine, but it was a time-sensitive medicine, and for us to wait for the government to get us the medicine would have taken months. And the doctors told us, like, blatantly honest, they were like, hey, look, we're good doctors, because our doctors are actually really good, but the system in place isn't really good for the doctors. So the doctors told us, the medicine he needs is this one. It was quite expensive, so it was kind of a debate for us whether we were going to go through the government or through private healthcare to get it. And he told us that if we went through the government, it was going to take too long, and my grandfather might be in much worse conditions if he were to wait that long. And so we went straight away and just bought it immediately, and that extended his life period for quite some time, over almost a year, which was kind of like that. Why would we go public healthcare? By the time we get the medicine, he can be in much worse condition, then it's kind of pointless. So that's why most people go through private healthcare. But sadly, most of the population is also still in poverty and still uses the public healthcare system because they can't afford private healthcare.
So as you can see, the problem lies in the fact that private healthcare is often not an option for many of the citizens. Therefore, the majority of citizens still rely on the public healthcare system. The major distribution of physicians lies in the wealthier parts of the country. Because of this, there are not enough physicians to provide adequate healthcare to the citizens who cannot afford to pay for visits and treatments. Though the physicians are just as educated, they lack the numbers to provide satisfactory service to all of the citizens. Now we can hear a story from a U.S. citizen who had an experience in a Hispanic country in one of their hospitals.
Hi, I'm Alyssa, and after high school I had the opportunity to move to Costa Rica for a year, which is the country besides Panama. And I moved to Costa Rica because I wanted to study the culture and do mission work and study Spanish and the Bible. And while I was there, I was fortunate enough to have 2 different experiences in their hospitals.
Okay, so if you had to compare the hospitals here in America to the hospitals there, what would you say?
Honestly, I would say the hospitals in Costa Rica are better than the ones here. I was served better and they had much more better hospitality, and they were more quick to get to my service instead of waiting around and waiting in like the emergency room or anything like that. And it was just, you could tell they genuinely cared for me.
So, as you can see, the healthcare in Hispanic countries, especially countries such as Panama and Costa Rica that have more developed areas, is often on the same level as healthcare here in the United States. Unfortunately, this level of healthcare is often not available for many of the citizens who must rely on the free healthcare provided by the government. As the countries continue to develop, hopes are that their high level of healthcare will be available to the majority of their citizens.